under regulation crowdfunding is not investment advice.
Rising with the crowd, power unbound, change makers lead where hope is found. Superpowers for good, shaping the fate. Investors and dreamers open the gate. Supercross stands loud, proud, and true, building tomorrow.
Hello everyone, I am just so excited. We have, wow, world-changing, life-altering, amazing companies ready to pitch tonight at the Superpowers for Good live pitch. We are just thrilled and excited to have you all here. We have an amazing program for you tonight. Welcome, and thank you very much for joining us for this incredible event. The way this will work is we'll have four companies. Each one in turn will pitch. And while they're pitching, you can be thinking about questions that you will ask them. Because you, the television audience, can ask questions. If you happen to be watching on social media somewhere, YouTube or elsewhere, you can submit your questions right in the comments there. But if you're watching on television, we'll display a link that will enable you to submit your questions on your phone while you're watching. So we're excited to have you ask questions. So be thoughtful about what you want to know about each one of the companies, and then at the end of the program, you'll get to vote to pick your favorite company from among the four companies that pitch. So this is really going to be fun stuff. Very opportunity. This is why it's so much better than there's that other little show some of you have heard of, that Shark Tank show, where you get to watch rich people make investment decisions and you don't get to participate. You think, I would sure love to be able to participate in that. No can do, right? Well, you can tonight. You can invest in any and all of the companies. I also want to invite you to join us for Supercrowd 26 in August. Scan this QR code that's on the screen right now, or visit supercrowd26.com to learn more about that amazing event. But it really will be special. For tonight, we have three amazing judges. I don't like to think of them as sharks, but they're sharper than any of the sharks that I know. These are astounding, amazing people who are all professional investors who are thinking about investing in these deals. Some of them may already have invested. I know I've invested in a couple of the companies you'll see tonight, just like you can, just like our investors, judges can, you can. So our judges include Leah Bollier-Gautreau from King's Crowd. She's a senior analyst there. She does all of the impact investment in analysis and helps manage the fund there at King's Crowd, with the focus, her focus being on impact investing. So she really is, one of the leading experts on impact. It may be the leading expert on impact crowdfunding from an investment standpoint. She's truly amazing. And then we've got Woody Neese. Woody is one of the true OGs of crowdfunding, right? He was among those who was so involved in the passage of the law that enables what we're doing tonight that he was invited to the White House for the signing ceremony. This is no joke. He's a big deal. He's one of our judges. He too manages a fund. And so he is approaching this from the standpoint of an actual investor putting money to work in these kinds of deals. And finally, Paul Lovejoy will be our final judge. Paul is an amazing human being who is really one of the thought leaders in crowdfunding today, just an amazing activist for this movement, who is also a registered investment advisor who's building a big clientele among people who are investing actively in this space. Truly a genius. We're thrilled to have him. Three professional investors who know exactly what they're doing, all here tonight. With that, we're going to take a short break, and then we'll come back and we'll get started with our first pitch. We're moving fast tonight. Hang on with us. Digital Niche Agency is the top investor acquisition agency. DNA has helped founders raise over 9 figures via regulated investment crowdfunding with a 3-pronged strategy using digital advertising, content marketing, and strategic outreach. Book a call today.
You don't need a pitch deck. You need a following. Because in this era, the crowd is the capital. Raise from your fans. Turn customers into shareholders. Launch your round on your terms. Dealmaker. Equity crowdfunding for the new era.
Welcome to Cineblock Films, the platform for fans, adventurous investors, and bold filmmakers. With a click, explore, fund, or pitch the next film, series, streaming channel, or gaming experience. Get insider access, invest, collaborate, and bring your ideas to life. All from cineblockfilms.com.
Welcome back. We are ready to go now. I am so excited to introduce you now to our first presenter, who will be Dale Walker. She is an amazing scientist who is developing new drugs for cancer treatment that could really be the linchpin for solutions to eradicating cancer as a public health threat. I am so excited for you all to hear her presentation. With that, Dale, let me pull up your slides. We'll turn you loose on this, but I am so excited to hear your presentation. Take it away.
Oh, well, thank you for having me. When my twin brother and I were only 15 months old, our father, shown here, died of acute myeloid leukemia. His cancer had become resistant to the available treatments. This year, in this country alone, more than 600,000 people will die due to cancer. And for the majority of those people, their cancers will have stopped responding to existing treatments. Just keep pushing. Drug resistance is the single biggest unsolved problem. And being able to improve the treatments for cancer and pathogenic viruses. BRG Therapeutics offers a potential solution. BRG drugs build off of a molecule that I'm showing in an orange circle. And this molecule is the active form of an older FDA-approved drug that induces potent normal cell protective effects in normal cells. And it also is reported to induce anti-cancer effects sporadically but potently in animals and in people. In the BRG drug family compounds, we link this compound to thiol polymers, which are conjugates in FDA-approved drugs. And because we are able to change the polymers, we're able to make different BRG drugs. And BRG drugs work against viruses that are representative of the 3 major viral genome classes. We also have taken 2 BRG drugs and we have tested them in 15 hard-to-treat human cancer cell lines representative of tissues that are cancer-prone in humans, and they induce lethal effects in all cancers tested to date, including in the cancer that killed my dad. And they achieve this at doses that are safe for normal cells, but that's not all they do. We have taken tumors that are resistant to a specific anti-cancer agent, and we have treated cells from those tumors in tissue culture with that agent and also with a BRG drug. And our data support the conclusion that the BRG drug alters drug resistance mechanisms so that the two agents can work together to kill nearly all of the cancer cells after just one exposure. And they do this, we've now shown this for 6 human cancer cell lines, and we've shown it for 3 different kinds of anti-cancer agents. So how do they do this? They do it like elephants. Elephants have rates of cancer that are only 1/4 to 1/5 that of humans, and they rarely die from cancer. And this is due to the potency of their p53 protein and network system. BRG drugs target this system so that they can induce effects that approximate those that occur naturally in elephants. BRG drug competitors do not report having similar kinds of activity. So the oncology and antiviral drugs markets are large. They are in the billions to hundreds of billions of dollars. What I'm telling you now is just contextual examples, and these are not intended to predict future BRG drug value. And we have been aided by an absolutely phenomenal team. We would not be where we are if it were not for them. And several people on our team have experience taking drugs all the way from the bench to the marketplace. So right now, we are in the middle of what is called preclinical drug development, and this is how we propose to move forward. We're going to perform 2 sets of studies. One set of studies will be in mice to show safety and to look at drug distribution, and then another set will look at anti-cancer effects. And so I would like to invite you to explore how we can work together to advance this technology and improve lives. Thank you.
Great job, Dale. Great job. That was, I know, a little stressful because there was a little bit of a technology problem, but I really appreciate you. Appreciate you. Let's see here. Let's bring our judges on. We've got to figure out this audio problem, but let me bring the judges on. We've got to figure out this audio problem, but let me bring the judges on. Let's see, where did I hide? Oh, there's
live TV.
Okay, that's right. We gotta. Okay, I'm gonna take all these slides off. I'm gonna take me off. I'm gonna take all these slides off. I'm gonna take me off.
Maybe we can all mute ourselves until it's time for our time to speak.
Maybe we can all mute ourselves until.
Much better.
Yeah, I think we've addressed that. I'm not sure exactly, but yeah, I think Paul's suggestion that we keep ourselves muted is going to be key. Paul's suggestion that we keep ourselves muted is going to be key. So, Paul, why don't you get us started?
Okay, yeah. Dale, how's it going? I really loved what you have got going here with the whole story. It reminds me of Alexander Fleming when he discovered penicillin, leaving the mold out and seeing that it ate the bacteria. And you kind of have a similar story too. I'm really interested by it. And not only that, you, Dale, and your husband and co-founder Vernon have personally invested $1.8 million and put $1.2 million in sweat equity into this research. I mean, that shows a lot of faith in what you're doing. So what I want to know really though is what is your Alexander Fleming story? What was it that you were like, oh my gosh, I need to focused my entire life on pursuing that. I'm really curious to hear that.
Alexander Fleming's story is closer to Alexander Fleming than you would think, because Alexander Fleming gave up. It was actually, I believe it was a man by the last name of Foley. They were not able to isolate the active ingredient, and another group came in and they did it. And over 130 people have published attempts to develop what we call the BRG therapeutics. And they're the ones who published partial solutions. We have no idea how many people actually just gave up. And so that was probably our aha moment. And even though I've talked mostly about cancer, our aha moment was viruses. And it was an HIV virus. And it was not supposed to work against the HIV virus, and it wiped it out. A few days, no replication, gone. And it was doing it at doses that we know are safe for normal cells, because, as I was telling you, our active ingredient is part of an FDA-approved drug. We're repurposing this. So, I don't want to take up all the time, but I definitely remember sitting in my office and all of a sudden looking at the data and going, oh my God, what have we got? And, the people who came in after Fleming, and they said, no, this is too valuable. We are not giving up on this. We're going to make it work. That was our experience.
I love it. Great story.
Paul,
Yeah,
does
that's
that
great.
answer your question?
I love it.
Yeah,
Great story.
Let's give Leah a chance.
Thank you, Devin. You see, Dale, when I'm looking at companies like you, biotech, cancer treatment, what I'm looking for are truly solutions that are disruptive and kind of going above and beyond what already have been done. And typically, this kind of brings a bit of controversy. So what I'd like to ask you right now is, how are your peers actually responding to your technology, to your new therapeutics? Have you seen any critics? And can you please share these critics? Let's not be afraid of the critics and tell us why are they wrong.
So that's a really good question. I appreciate you asking it. Our critics really fall into two categories. There are a number of people who are familiar with all of the efforts to make this active ingredient do what we're getting it to do now. And they've seen so many failures that they simply say, and I quote, I do not believe you. That's group one. Then there's group two, and they are saying, and we can go into why, but they're saying, show us that it's safe. And then they say, if it's safe, and they're not even saying, show me that it works against cancer or against viruses. They're just saying, show me that it's safe. And they say, if it's safe, it's paradigm shifting, it's potentially a blockbuster, and it can make major changes in the way we look at viruses and cancer. And those people, there are probably fewer people in that second group, but they're still there.
That's great.
Did that answer your question?
Woody, what would you like to know?
That's great. Woody.
Hey, Dale. Great job. What you're working on is truly fascinating. I have a 9-year-old neighbor that we just found out is in remission. And so these cancer treatments are so critical to so many people's lives, and they touch us all over. But getting these drugs across the finish line takes a lot of time, a lot of resources, a lot of people. Have you thought about how much it's going to cost to completely get this done? And where are you in terms of the amount of capital that you'll need to actually pull that off?
very fortunate to have a benefactor who has given us $40,000 and who has offered to give us another $40,000. And because we have learned to ride by the skin of our teeth, I guess is one expression, we know that we can do the safety studies and one anti-cancer studies with the funds that we have. And then, unfortunately, there was a glitch with my slide, so I wasn't able to show it to you. But then we plan to exit by licensing or selling to a large pharmaceutical company. And the reason for that is that peer-reviewed papers have found that if a small company like mine exits at that point through licensing or sale to a big pharma company with lots of expertise and deep pockets, the probability of the drug making it to market is significantly higher, very significantly higher, and it also maximizes the drug value. But our goal is get this drug to market and get it working for people. And then the other thing is, because this drug is a new construct, not a new chemical entity. And it fits into that class because the major active ingredient is the active form of an FDA-approved drug. So that makes open to us the 505(b)(2) pathway for regulatory approval, and that's supposed to be less expensive and faster. And Woody, may I tell you,
Yes.
I'm so sorry. I don't know what happened with my slides, but I have to thank you for mentioning your 9-year-old son, because that's why I came up with the elephant.
Okay, well, it's my neighbor. Don't worry. Does it mean that you will not have to go through all of the fundraising that you would need if you can license this sooner? And then when do you actually license this? Like at what point, where in the evolution do you have to be in order to get one of these pharma companies to license the product, the drug?
Well, I'll tell you what they have told us. They've said, show us the safety data. And we are talking to 2 companies right now. And one of them has said, show us the safety data. And the other one has said, show us the safety data and a tiny bit of efficacy, and the talks begin.
Thank you.
Does that answer your question?
Yep, it helps. Thank you.
So we anticipate, we expect to be talking this year, and we hope to be able to exit in not more than 2 years from right now.
Perfect.
This is
Thank you.
great stuff. Great stuff. Now, I want to just come back, Paul. Since you got us started, why don't you give a follow-up question for us real quickly? We got about 2 minutes.
Well, despite having potentially one of the greatest discoveries in humankind, you haven't had great traction with your raise to date. Well, why do you think that is?
Well, actually, there are 2 reasons. We thought that we were going to get a major raise, and we spent a month working on that one possibility, and it was really intensive. I was working on it all day long, 7 days a week, and unfortunately, that did not work out. So for complicated reasons. So I need to go back to getting the word out to a greater extent, which is one of the reasons I'm here.
That's a good answer.
The other thing I could say, Paul, is that I know I've talked to people and they say, oh, I don't get the chemistry. I can't do that because I don't understand the chemistry. So being in this particular area of science does pose some problems. But I think, hanging in there and not giving up is the key.
I'm sure
Does that
you're
answer your
right,
question?
Dale. I'm sure you're right. That's great. This has been a great discussion and a great way to kick off this quarter's Superpowers for Good live pitch. Oh my gosh. Dale, I love what you're doing. That's why I've invested. I'm not one of the judges tonight. I don't get to vote with the crowd. I don't get to help pick the winner, but I am. I love what you're doing. My father died of cancer. This certainly resonates as being highly relevant, and so I'm excited to see you succeed. We're going to take a quick break now, guys, and then we will come back with our next presenter, and that's going to be, of course, Gigawatt with Deep Patel. So stick around, folks. You don't want to miss. I mean, it just keeps getting better. You don't want to miss this.
Digital Niche Agency is the top investor acquisition agency. DNA has helped founders raise over 9 figures via regulated investment crowdfunding with a 3-pronged strategy using digital advertising, content marketing, and strategic outreach. Book a call today.
Your community isn't just support, it's capital. It's belief, loyalty, and dollars. Turn your customers into shareholders. Let them own a piece of what they helped build. Grow together. Stronger, louder, funded, deal maker.
If you're building a company driven by purpose and proving it with real revenue growth, this is for you. Purpose Built 100 recognizes the 100 fastest growing purpose-driven companies in America, selected based on documented 5-year revenue growth. Winners are featured in a nationally televised showcase and a hardbound book. Built on purpose. Proven by growth. Apply now at purposebuilt100.com.
Welcome back. I'm so excited now. I get to introduce you to Deep Patel. Deep, have you got your slides ready?
Yes, sir. I got them ready.
Okay. Great. Let's let her rip. You got 5 minutes.
Okay, thanks, Devin. We're building the Home Depot of solar and battery storage systems, a one-stop shop where customers can design, buy, and deploy complete energy systems. I'm Deep Patel, founder and CEO of Gigawatt. Just a quick note, this offering is being conducted through Start Engine. All the details are available on the platform. Scan the QR code and go to the Start Engine page if you want to learn more. Energy costs are rising fast, but solar is still too expensive, too complicated, and too slow to permit. Customers want energy independence, but the process is broken. We solve this with complete DIY solar and battery storage kits. Everything arrives together, engineered, compatible, and ready to install. We simplify what used to take multiple vendors into one seamless experience. Our customers look like Home Depot customers, DIYers, contractors, and home builders. People who want control, value, and trusted equipment, not just products. We've generated over $64 million in revenue since 2019. We operate at a 32% gross margin with room to improve, and we have over $1 million in backlog. So the demand's real. This isn't a concept, we're already scaling. What makes us different is the platform. We combine design, plan drafting, interconnection, permit services, and direct-to-consumer sales. No one offers the full stack. Our competitors just sell pieces and parts. It's a massive market, $25 billion total, $10 billion serviceable, and a fast-growing $1 billion DIY segment. We're targeting a clear path to $100 million in revenue. We're trusted by thousands of customers. DIYers, and professionals. This is a repeatable, proven model. Our word of mouth and referrals are a major growth driver. We've shown consistent revenue with strong unit economics, and now we're going to be scaling. Projections show a path to 100 million by 2029. We've built a team that understands solar, inbound marketing, technical, and operations. This isn't our first time in building in this industry, and we're combining technical expertise with execution. To reach 100 million, we're focused on 4 key areas: product development to expand our offering, inventory to support the existing demand and improve margins, sales and marketing to accelerate our growth, and R&D to stay ahead of the market. This is what scaling's all about, and it's already working. Gigawatt is building the Home Depot of solar and battery storage. We have proven demand, strong margins, and a clear path to scale. Now it's all about execution. And you can scan the QR code at the top right to learn more about our deal on Start Engine. Thanks, Devin.
Wow, great presentation. I love what you're doing, and I'm excited to get our judges in here to, sharpen their little shark teeth here. Leo, why don't we get started with you? You've looked at this. What do you think?
Thank you. Now, I really love the DIY solution. You see, the first thing I kind of wonder when I look at this company was how different is this from Enphase Energy and just all of these big companies out there? Well, that's because it offers the possibility for anyone to install solar panels on their own roof. So this is definitely great. The question that I'm asking myself here is, I kind of look at your revenue and I saw that between 2023 and 2024, there was a pretty steep decline of somewhere around 20%. So I'm wondering what happened there, and did you do better in 2025?
Yes, absolutely. That great question. There were some policy changes in California. We had a concentration of customers in California, and there's something called NEM 3 that passed, and sales declined due to the policy change. And although sales declined, gross profit dollars increased. And we focused on raising our gross margin, even though sales declined. And 2025, we had a record year, both on the revenue side and the gross margins. We got the gross margins up to 32% and sales to about $11 million. So we had a record year, and we believe the future is very strong. With the war in Iran, it's causing an energy crisis now in solar and storage. We're getting calls right now. People are panicked. They are looking into this, and they're buying because of this energy crisis that's coming. So I think we're positioned well with what we're offering.
Fabulous, fabulous. This is such an important and timely discussion, as you point out, Deep. Woody, what would you like to know?
Deep, I am all about do-it-yourself. I love little projects that I can do myself. I can make you a killer sourdough bread. I have fixed things around this house. The question that I have, though, is I live here in Colorado. Where the area that I live, a lot of people have solar on their roofs. One of our panels is got like a piece of hail went into it, and so it's busted. And I'm like, I am not going up on that roof and looking at that solar panel. How exactly are these products do-it-yourself? Are people actually buying this and then going up on the roofs and installing it? Is that safe? What is the risk associated with that? In theory, this sounds amazing, but in practical concept, is this really do-it-yourself?
Yeah, sure, Woody. We really call it do-it-your-own-way solar. And there's different types of do-it-yourself customers. Some of them have the trade skills, they're roofers, HVAC professionals, contractors. They're like, I got this, send me the kit, send me the instructions, I'll follow it. and I'm not scared of getting on the roof and doing it. And then there's customers that are kind of quasi project managers. They're like business folks. Well, they'll buy the kit from us and, our service support services, and they'll hire a local contractor to install it and just manage the project and save tens of thousands of dollars compared to going with a turnkey company with all the overhead and sales commissions and the things that make solar and storage just very expensive. So we help a lot of people just cut out all the junk costs and get them the kit, hook them up with an installer, and they can do it their own way.
How much does the installer add to it if they decide to go that route?
Anywhere from 55 cents to $1 a watt, depending on the market. So, a typical installer can charge anywhere from $5,000 to $10,000, depending on where they're at. In California, we have high insurance costs. Installations higher compared to Arizona and Texas, which will be on the lower end.
And then how long until these units pay for themselves?
I would say about 5 years with the do-it-your-own-way model, about 5 years. And it's regional. Obviously, California, Hawaii, you get the fastest paybacks. And then, Northeast are, very good paybacks. And then, the certain states have very low electricity. Those are going to be in the 7 to 8 years or so.
Okay, thank you.
Yep.
I live in the worst place in the world to buy power from the grid, just about. Maybe Paul is worse than me, but not many people. Paul, what's your question?
Yeah, actually, just last week, a few days ago, maybe 4 or 5 days ago, here in Honolulu, we lost total power. And there was 2 grocery stores right next to my house. One of them has a solar microgrid, and the other one doesn't. Guess which one was open, and guess which one had lines out the door because it was the only thing open.
Yeah.
Obviously the solar microgrid. And so what you're doing, I think, is so important to have this decentralized distributed energy, because AI is consuming so much more energy. There's all this, we're electrifying everything. It's only going to get worse and worse, and the demand's getting greater. So Deep, I just really believe in what you're doing. And it's what you've built is genuinely impressive. 19 years operating. Wow. And what I think is there is a little bit of a tension here, though, when I dug into this offering, and is that you built this business on customers who value independence and self-sufficiency, do it your own way. How do you convince that same customer to pay you a monthly subscription fee with this new added service that you're offering now?
Yeah, that's a great question, Paul. And these energy storage systems are becoming extremely common now. Everyone wants a backup battery. But when the grid fails and the battery doesn't work, you're going to need 24-hour, 7 days a week support. You're going to have to call in. Someone's going to have to pick up the phone and make sure they can resolve that problem immediately so the battery works when it's really needed to work. And, there's reoccurring servicing opportunities to make sure that battery is going to be functioning right when the grid fails. So the battery adds more complexity, which creates a demand for service. And we can sell a premium service package on a monthly basis that can basically keep people subscribed to a subscription package.
But if you don't have the subscription, will it still work?
Yeah, it's you're buying insurance, Paul. You could still, some of our customers, the grid goes down, they're super technical, they can figure it out, get the system back up. Some customers need a little bit more handholding. They're going to want to call someone. They're going to need a 24-hour, concierge that can help them resolve their issue.
All right, cool.
Yeah.
Well, we are. This is such a fun conversation. I'm in the middle of waiting for my solar to be installed, and I remember thinking about maybe doing it on my own. because I did a small solar installation on my RV a few years back. Very proud of that because I didn't know the difference between a wrench and a screwdriver when I started. So it was a big learning curve. But why don't we come back to you, Leah? What else would you like to know about Deep's offering?
It's a very competitive market, and I feel like in such markets you need a founder that is strong and motivated. And so, Deep, you've been at it for 19 years. What makes you still want to move forward with the company, keep growing it? Can you tell us kind of what you've learned and what your passion, your motivation comes from?
Yeah. Yeah, that's a great question. 19 years, riding the solar coaster, we call it. It's got crazy ups and downs, local, state, federal level policies, trade, everything touches this industry. It's like, it could be like really great and really bad at the same time. And over the 19 years, I've just met a lot of people in this industry that have become some of my best friends. And, they've come to like my birthday parties and, like significant events in my life. And, you just become friends with who you do business with over a long period of time. And the customers, every time I go to their homes and they're, talking about their systems and they're, showing me and bragging, I just feel good about, what I'm doing for the customers. And finally, everyone is on a mission, including our customers. They're just like really satisfied with, one, saving money and then doing something that's better for the world. So, I feel like the work I'm doing when I'm on my deathbed and I'm looking back, I'm going to be like, hey, I made a difference. I really did. Like I didn't just clock in, clock out somewhere and make some money. I left this world a better place.
Excellent. Excellent. Paul, do you have a follow-up?
Yeah. So Deep, you're actually kind of the founder I look for to invest in. You're methodical, you're very thoughtful, and I just appreciate that about you and what you've built. So what does success look like for Gigawatt in 10 years? And does that include selling the business?
Yeah, so success looks like, getting over $100 million in revenue. That means I'm helping even more customers. I'm getting to the scaling goals we want to get to. We're reaching our mission of 1 gigawatt of solar panels and battery storage implemented in society. And at that level, there's a lot of serious acquisition opportunities. When you build a $100 million revenue business, you have a lot of optionality from that point. And so, yeah, an exit can be one option, and dividends, paying our investors back dividends can be another option. So we have a lot of ways we can, have an exit strategy in the future.
Fantastic. Woody, do you have a follow-up?
I just want to know how you keep so young after 19 years of doing this. No, I'm just kidding. I'm just kidding. While you were saying 19 years, I was like, how's he been doing this for 19 years? So we all live in this world of supply chain, tariffs. You even touched on it. How have tariffs impacted what you are doing in terms of, is your product manufactured locally? Are you importing it? What impact has that had on your operations?
Yeah, it's a global supply chain, and I guess the fortunate part of the solar industry is it's been in a trade war since like 2015, right? There's been trade cases going on with solar, so we kind of navigated the whole trade war stuff like way early on, and kind of made some adjustments with the business to be able to handle the tariffs. For example, a lot of this stuff coming from China went to Southeast Asia, Vietnam, and other countries. So the supply chain lifted and shifted. And, a lot of this stuff doesn't come from China anymore. So it's all coming from like a global supply chain, including the United States.
but they all have tariffs slapped on them right now. That's traveling
Yes.
through to you and your customers, no?
Yeah, they do. Although the domestic supply chain, there's not really much, being manufactured here at this point. So there's really no alternative. So the consumers and the companies have to pay the tariff until the domestic supply chain builds up, and starts servicing the demand. And it's kind of an iffy subject because a lot of the large manufacturers, they don't know if when the administration turns, if the tariffs go away and they build a $500 million factory, they could be totally upside down, So it's a very sticky situation right now where people are waiting and seeing what to do.
Yeah.
Yeah,
Okay.
what a challenge. What a
Yeah.
challenge. You know, Deep, this is incredible work. I want to invite everyone to check out this investment opportunity at s4g.biz/gigawatt. And I also want to remind everyone that if you have a question for one of our founders, you're invited to ask the question. You can submit that at s4g.biz/question. So get your browser up, get your phone out and pull up your browser, type that in, or just scan that QR code that's on the screen right now. If you happen to be among the few who are watching on social media, you can just submit your questions right in the comments there on YouTube or Facebook or LinkedIn, and we'll see those questions come in the comments, and we can answer them there. If you're watching on television, submit your questions at s4g.biz/question. And I would note too that if you submit your questions and we don't get to them during the show, we'll pass them along to the founders so that they can ask you after. And finally, I want to invite all of you to stick around for the private investor session. I say stick around. We're actually moving to an ordinary Zoom where anyone who wants to come ask questions of our founders face to face is invited. Now, we want you to self-screen. If you are coming to pitch them, probably not the right forum. But if you are interested in investing, come by, ask your questions, and they'll be able to answer your questions in detail and with specificity. We'll give each of the founders a private room, and there'll be kind of a no holds barred kind of environment where we won't allow AI or other recordings. It's going to be a forum where our founders can really be a little more open and honest and forthright in answering your individual questions. With that, we've got to get ready for our next founder, but Deep, congratulations, great pitch. We're thrilled to have you here. Judges, great job. We're going to take a minute and be right back.
Digital Niche Agency is the top investor acquisition agency. DNA has helped founders raise over 9 figures via regulated investment crowdfunding with a 3-pronged strategy using digital advertising, content marketing, and strategic outreach. Book a call today.
Don't pitch another VC. Pitch your people. The ones who get it. The ones who want in. Keep your vision. Keep your cap table clean. Own your raise. Every step, every share. Raise with Dealmaker. This is capital on your terms.
If you're building a company driven by purpose and proving it with real revenue growth, this is for you. Purpose Built 100 recognizes the 100 fastest growing purpose-driven companies in America, selected based on documented 5-year revenue growth. Winners are featured in a nationally televised showcase and a hardbound book, Built on Purpose. Proven by growth. Apply now at purposebuilt100.com.
Welcome back, everyone. I'm having so much fun. This is just wild. We've got such great presenters today. Our next presenter is doing something that's near and dear to me. I've lost family members to diabetes. Many of my living family members deal with it every day. And so it is something that to say is near and dear. This is close to my heart, and I'm excited to have Dr. Prem Sahas here to present. We are really excited to hear from you. Have you got your slides ready to go?
Yes, yeah, I do have the slides.
Okay. We're eager to hear from you and hear your presentation. I just think you're going to be great. Having heard this in rehearsal, I'm excited to see what have you share your story with us. So take it away.
Thank you, Devin. I'm Dr. Prem Sahas. I'm the founder, CEO of My Diabetes Health. It's a tech-enabled digital platform with human touch. What we do is we provide diabetes education, medical nutrition therapy, device training for people with diabetes. What we have done is we have built the future of metabolic health. I've been practicing endocrinology for the last 20 years. I would like to give an example why diabetes education is so important. I had a patient who came in with diabetes for over 10 years, has the right medication, has the device to monitor his diabetes. But what he was lacking was the education needed to self-manage his diabetes. So there are millions of people like that. And diabetes is a huge issue. Almost 40 million people living in this country with diabetes. And the prevalence is going to increase over the next decades. So diabetes education is found to be effective, but the utilization of diabetes education is very low. Only 5 to 7% of the people receive education in the first year. The reason is 62% of the non-metropolitan counties do not have a diabetes education program. So we came with this solution. We are a team of certified diabetes educators. We work with the providers. We provide education for type 1 diabetes, type 2 diabetes. We have specialized programs. We launched the first ever pediatric diabetes education program today. We have programs for educating diabetes in pregnancy. We do the device training. We also provide the one-on-one behavior guidance and support. And all education is provided by the CDCES. They are registered nurses or dietitians who have additional certification to be a diabetes educator. It's a one-on-one individualized education session, and we provide the clinical support that prevents a $120 session from turning into a $20,000 ER visit. So insurance companies like us. And what I'm proud of is our outcomes. So our outcomes are, we have over 10,000 patients who went through our program, and we have shown a 1.6 drop in hemoglobin A1C, which translates to almost 60% reduction in complications related to diabetes. And I like to also share that our patient experience, patient satisfaction score is around 99%. So I call it the human ROI. We improving the access. 40% of our educators speak Spanish, so we are removing the language barriers and improving the outcomes to reduce complications. So why MTT is different is we work on the blue ocean. So 40% of this country are insured by Medicare, Medicaid, or TRICARE. We are growing in that space. And I call it the red ocean. There are lots of players in the employers market. And we are very different from the red ocean. And our business model is we work with health plans, health systems. The health plans, they search their database and find the high-risk patients and refer patients to us. For example, Aetna in Illinois referred around 15,000 patients to us this month. And health systems, we work with large health systems like Adventist Health, Presbyterian Health, who refer patients to us. And we also have durable medical equipment channel partners like Cardinal Health, Rotec, Ascentus, they have thousands of sales reps who go to the doctor's office, get the signature to refer to MDT, and we do the device training. So we are scaling nationwide with a low customer acquisition cost. And our business model is simple. We get paid $120. We pay the $45 to the educator, 61% gross margin. So we grew 3x in 2024. We doubled in 2025, raised 2.3 million in 2025. We are cash flow break even in 26, and we are going to raise 6 million in 2026. And the success is the team, very seasoned executives. And I invite you to invest in My Diabetes Health, invest in the future you want to live in. We have a campaign open on Start Engine, and previously we were backed by the VCs. Thank you.
Fantastic. Great presentation. I love what you're doing. I want to invite and just remind everyone that if you've got a question for Dr. Sahas, you don't need to wait for the after session, though you're invited to that. You're invited to submit your questions online right now, s4g.biz/question. Again, that's s4g.biz/question. You can also join us afterward for the investor session. Shannon will put the link on there to register for that too. But there you can ask Dr. Sahas his questions. And of course, we'll put the link back up on the screen for investing, but s4g.biz/diabetes will get you an opportunity to see the investment. So there's lots of ways for you to engage if you're watching at home. I encourage you to do it. With that, let me turn the time over to Woody to get us started. What do you want to know?
You're targeting such a big market with something that is critically important. The thing that I always, whenever I hear education, I always think, is it, how do you keep people coming back? It's a tough business model because, by the way, kudos to you that you're seeing revenue growth year over year. So clearly you're doing something right. But how do you keep people coming back? How do you make it sticky? How do you make it fun? Is it the clinical where it's just online? Is there an app that people use? How do you track these outcomes to keep people engaged in what you're doing?
So the insurance companies pay 10 hours of education during the first year, and it's like a recurrent revenue. Patient can come back the following years for 2 hours. So we have a secret sauce why patient come back. So we provide the education in the same language. We have the contents in the patient's language. The same educator goes through the entire session and built a rapport. And we are also building an AI chatbot which engages patients between educator visits. And that AI chatbot and the patient engagement brings in the patients for the following years.
Okay, great.
That's great. Leah, what do you want to know?
Hi, doctor. So you actually are building a platform related to medication adherence, which is probably one of the biggest reasons why some treatment don't work is not because of the medicine, but because of patients' adherence. And you have the potential to actually acquire a lot of data on patient behavior. Are you using that data in any way? Do you feel like this is giving you a competitive edge on competition?
So we do collect data, and we probably already have a good database. The data becomes significant. We have 10,000 patients now. The data becomes significant when we have patients over 100,000. But we do have the data of all the patients.
And do you feel like you can kind of integrate it in some way to make your product better and to make it more defensible?
Yes, we can make use of the data, and we already collect data like hemoglobin A1Cs, the patient's lab values. We look at that's how we show our outcomes. We look at the baseline data like the A1Cs, lipids, and we do look at the same numbers after the education sessions, and that shows our outcome. And we also keep track of the patient's medication adherence, and improve the compliance of the patients.
Fantastic. Now, as you think about this, Paul, what would you like to know?
Yeah, Dr. Sahas, I mean, heart disease is the number one killer in the United States, and diabetes is a significant reason for that being the case. So what you're doing is truly important. You know, an ounce of prevention is worth more than a pound of cure. That's what my grandmother used to say, and that's exactly what you're doing with my diabetes health. You served already 8,600 patients with clinically significant results and generated what, 2.3 million in confirmed revenue last year?
Yes.
That is so impressive. I mean, you already have built something. This isn't a vision. This is actually happening. The one thing that struck me that I felt a little uncomfortable with is your concurrent private offering. And those wealthier investors are paying 39% less per share than the public crowd investors. I'm just curious why that is.
So we have a VC who is going to close the Series A, which we had committed earlier. Once that VC close, that's why we showed that we still have a private offering at the lower price. So basically, right now the only offering right now is through the start engine.
It said it's still concurrent, so you're just waiting for one person. That's why you're keeping it open at this. Okay. Okay.
Excellent.
And well, actually, why did you choose to have it higher for the crowd? I mean, what changed? I mean, that's what I don't get. Like, why so much higher?
So we did the valuation at that time. We had more in 2026, later part of 2025, when we did the valuation, we had lots of big contracts, which is going to grow the business to a nationwide model. So our valuation went up at the time when we closed with the start engine.
Okay.
Excellent. Excellent. Woody, do you have a follow-up question?
I do. So we've seen how AI is disrupting everything. Clearly, you've got these clinicians that are providing educational support. If, you know, I don't know how hard it is to find them. You know, granted, they get paid out of it, which is good. But, you know, talk to me about how you're thinking about how AI might integrate into what you're doing, how it might allow you to scale faster. You know, this seems like a great opportunity where you can integrate some AI into what you're doing.
So, as I mentioned earlier, having an AI chatbot will engage the patient's between visits, and answer the frequently asked questions. So that's one way we can use the AI. We can use AI to improve the operation, but I strongly believe AI is not going to replace the diabetes educators, because we do a assessment visit, the first visit, and provide the education. Our education is very individualized. It's not a cookie cutter program. It's a very personalized program. And so AI can improve the operation as well as have like a chatbot to answer the questions and improve the operations. That's what I see AI being used at my diabetes center.
Okay, thanks.
Excellent. Excellent. I'm going to take that out. Woody, do you have a follow-up?
I just did.
Another follow-up? Okay, so let's come back to you. I'm a little discombobulated. No one's ever been discombobulated except me. I'm the first and only one who's ever been discombobulated. I apologize. Leah, go ahead.
Oh, good. I'm wondering, do you have data related to customer retention, let's say 6 months and 12 months? I'd like to see how, you know, it's not only about are your the patients sticking to their medicine, but are they sticking to the platform as well?
So currently, 40% of our patients are coming back for the following years. And once we implement the AI chatbot, we want to increase it to 60 to 70%.
Do you know what happens to this 60%? Why do they not stick?
I think one of the reason is that we need a referral for the subsequent years as per the Medicare rules from the provider to come back. So the patient has to go back to the provider, get a referral for next year. That could be one of the reasons why the patients are not coming back. But we strongly believe launching the AI chatbot will bring back, increase our customers coming back for the following year to 70%. Thank you.
Fantastic. Let me just point out as we wrap up with Dr. Sahas that you can learn more at s4g.biz/diabetes, or if you've got your phone handy, just scan the QR code that's on the screen, kind of down there in the corner, almost over my face. That's the one you want. Scan that bad boy, and you can learn more about investing right now today. This is all these deals, and I should have said this at the outset, every one of these offerings is open to ordinary investors. You don't need to have a PhD in finance. You don't need to be wealthy. You don't need to be anything but a human being, and you can invest. The law in the United States is pretty clear. Everyone is eligible to do at least a little bit. So I want to encourage you all to take a look at that. Remember, if you have a question for Dr. Sahas or anyone else, you can put those in the chat or in the comments if you're watching on social media, or you can also submit those via our Q&A form at s4g.biz/question. And finally, we'll be having an investor session where if you would like to talk to the founders face-to-face in a Zoom, I invite you to do that. You can come by. Now, we ask you to self-screen. If you're interested in investing, we want you there, even if it's a small amount. This is the perfect time for you to come by and ask questions, learn more, and make a wiser decision about investing your money. So please join us. Shannon will put the link on the screen again for you here in a minute, but you can check it out. We would love very much to have you. Dr. Sahas, again, I want to congratulate you on the great work that you're doing. Having seen my family members literally pass away in the extreme as a direct result. I had a family member who had a massive heart attack in her late 30s, directly as a complication of her diabetes. She died in her early 50s. Tragic loss. And so what you're doing means a lot to me. Anything that we can do to improve diabetes care saves lives and makes a difference in quality of life as well. So I commend you for what you're doing and hope everyone will give serious consideration to backing what you're doing. With that, it is yet time again for us to prepare for our next pitch. So hang on, folks.
Digital Niche Agency is the top investor acquisition agency. DNA has helped founders raise over 9 figures via regulated investment crowdfunding with a 3-pronged strategy using digital advertising, content marketing, and strategic outreach. Book a call today.
VCs don't fund communities, people do. When you raise from your community, you raise more than capital. You raise believers, advocates, ambassadors, built together, funded together. Equity crowdfunding, powered by Dealmaker.
If you're building a company driven by purpose and proving it with real revenue growth, this is for you. Purpose Built 100 recognizes the 100 fastest growing purpose-driven companies in America, selected based on documented 5-year revenue growth. Winners are featured in a nationally televised showcase and a hardbound book. Built on purpose. Proven by growth. Apply now at purposebuilt100.com.
Welcome back, everyone. As you can tell already, We're getting ready for the Our Health presentation. This is really an exciting one because it looks so much like a very famous company, but this one is totally for real and legitimate. I'm excited to introduce you to the founder and CEO, Dr. Eugene Chan. He's got a, a device that can test your blood from a single drop, and he's done it in space. It's for real, it's for legit. This is really exciting. Dr. Chan, take it away. We're so excited to hear from you today.
It's a pleasure to be here, Devin. I am Dr. Eugene Chan, and I founded Our Health because of my challenges, my personal challenges with getting blood information from our own samples. And so my own examples is that, each year I go see my primary care doctor, and it takes a few hours out of my day. And so that's a little bit challenging already, as a busy person. After that visit, they send me to Mass General Hospital, where essentially I have to go and wait 2 to 3 hours before I can get my venous blood draw. And they basically draw several vials of blood. And we're talking like, 2 or 3 vials. These are big vials of blood. And after that visit, I don't get the result. So I have to wait several days before that actually happens. And it's anxious time. And so basically 2 or 3 days later, I got my results in my portal. And this is me as a physician. And there's no interpretation with the results. I have to wait an extra month before my primary care provider sends me a letter and says, hey, Eugene, this is what you should be doing. You should be doing, eating these foods or, changing this to basically optimize your health. And that's just too long. So we can absolutely do better. And that's what we've done here at Our Health. We've designed this device, which is a tiny device that basically sits in your home, and it tests your blood in minutes, not days. There are 194 million Americans who need faster results. And these are individuals who want to improve their health or have a chronic condition where they need routine blood work. Here's how the technology works. First, you collect the sample using painless microneedle technology or a finger stick. You insert the blood and the cartridge into the reader, as shown here. And then the results are presented on an app on your phone in several minutes. And these results are easily interpretable. And in fact, they're actually linked with your medical record so that basically you have a full closing of the loop from obtaining your sample to basically getting your interpretation in minutes. Here's the pipeline of the test that we're developing. And you'll basically see they're color-coded. So the red ones are the ones that we're going to come out with first. These are the hematology and oncology tests. It includes complete blood count with differential. And this test is the most ordered test on the planet. So basically, it's billions of tests per year. It also includes the Pixaban and rivaroxaban. These are drug thinners that 16 million people take. Cancer flow cytometry for blood cancers, and also a test for hemophilia A patients. In the future, we're also going to be coming out with tests for infectious diseases, reproductive health, heart failure, kidney failure, and also vital signs. As you look at any medical device development, one of the key things is the burden of proof. And so you're looking at third-party validation. And in our case, we were selected to perform the most challenging third-party demonstration that's possible on the planet, and actually off the planet. So NASA selected us to test our device up in space. You can see here that that's the exact rocket that the Our Health One basically was shipped up to the International Space Station. Once it was on the International Space Station in zero gravity, an astronaut tested tiny samples of liquid and fluid and was able to match up the results highly accurately with a 200-pound machine that was at Johnson Space Center. Consequently, as part of our efforts, we were given this wonderful mission badge you see here on the right-hand side. And you'll see several paths, or several planets here. You've got Mars in the background. So basically the goal is to be able to, how do we keep astronauts healthy using this technology as we travel to Mars? So we feel very, very fortunate to be selected by NASA to send this technology to space. Along the way, they also rejected a company called Theranos, and also rejected basically all our competitors because shipping something up to space is extremely challenging, and they're going to just pick one. We've also partnered with other government agencies such as the NIH and also the United States Air Force, as well as pharma companies such as Novartis, Biogen, and AstraZeneca. We've won competitions using the technology. We've published in high-profile publications, have wonderful clinical collaborators, 17 patents, and to date, we've actually have $20 million of non-dilutive funding and revenue that's actually developed the technology, as well as $3 million of equity funding. So with this tech, it opens up the possibilities for new business models. In fact, one of the business models is well known to all of us. So basically, smartphones with multiple apps, the power in our pocket, has essentially replaced all the old gadgets that basically we all used to have. Alarm clocks, calculators, phones. With the Health technology, now you can have a single device and perform vast testing. And these tests are currently performed in the central lab with large machines, some of these 200-pound machines, and with lots of people. So clearly, this is a huge market opportunity of $323 billion of being able to perform these tests in your home. And we've got the team to do it. And our team basically has a very, very deep bench in medical devices, regulatory, getting products to the market, and also successful exits. So in summary, our Health is a well-positioned disruptive technology. There's a high human impact opportunity, and that's why I'm here. And here's your opportunity to invest in our Health. You can scan the QR code, and love to talk to you in the session afterwards.
Fantastic. All righty, folks. Let me remind you again, just to be clear, s4g.biz/question. We've had a few questions come in after the presenter presented. So if you have a question for Eugene now, this instant, the moment we're in now is the time to submit your question so we can get it and give it to Eugene before his time is done. I also want to invite you to check out, join us after for the session. Check out his website. But right now, submit your question, s4g.biz/question. Okay. Paul, why don't you get us started this time?
Yeah. Anytime I, of course, see the blood test, as Devin mentioned, I kind of have a Theranos reaction. But you're not Elizabeth Holmes. You're Dr. Eugene Chan. And you've developed something real and something that's so needed. And you've had tremendous validation, including what? 23 million in NASA and NIH funding. You guys won an X Prize. I mean, this is incredible. Now, I didn't see anywhere in your materials about marketing and sales. So once you clear FDA, who actually buys this and how do you reach them?
That's a great question. So, obviously, I think, right now we're sort of in this process of kind of transitioning from a dev company to a commercial company. So we're 12 months away from getting our first FDA registration. So as we're doing this, this is actually probably the reason why I'm here raising. So basically, we're here to basically ramp up and basically hire commercial folks who are going to basically take care of sales and marketing and commercial distribution. One of the great things about making a medical device that has to go through clinical trials is actually you get to meet your customers early. So basically, our clinical trial sites are going to be our first customers. So some of those names on our clinical partners list. We also have sort of additional names, which we will disclose reasonably soon. But these are major medical centers that treat a lot of these patients, and so they're not only are they seen as a valuable way to basically validate the technology, but they're also going to implement it in the hospital. And so for us, there's a sort of a path to the home, right? So how do you actually get this tech into your hands, as the viewer? And so for us, it's basically, the first step is actually you got to get the sort of buy-in from the medical and scientific community. So that's step number one. And then once you actually have that, then basically this tech is now distributed and cleared the regulatory hurdles and now it's basically out to where basically you can get access to it.
Excellent, excellent. Leo, what would you like to know?
Dr. Chen, thank you so much for building this product because you see, you don't like lab testing and I hate needles. So your needle is just way smaller and I just can't wait for the product to go on the market. But the first question that comes to mind is, do you think that your product is actually as accurate at lab testing? Could that truly replace labs that we regularly do today?
So in our demonstration on the space station, so I'm going to refer to third-party data because I didn't generate this data. So basically, the NASA demonstration was basically perfectly matched with what Johnson Space Center was measuring down in Houston. And we actually published this result in Nature Communications. And so, in fact, NASA was actually pretty, I think, they've got a high level of rigor, obviously. And so they didn't tell us what samples we were running. And so I was invited to essentially mission control to basically watch the whole thing. And so as Samantha Christopher was operating the tech, and somewhere midway they tell us basically what these samples are. I'm like, oh, okay, this is great. Thanks for telling us beforehand. And so they did it so basically you can't game the system, right? And so there was one sample where there was a discrepancy, right? Ooh, yeah, discrepancy, right? So basically our team basically sat around and was like, oh, yeah, there's no way that our device is wrong. And so at that point, we basically intervened and basically told NASA Mission Control, hey, you got to take these samples back down so that you can measure them at Johnson Space Center and see who's right. And so 2 months later, it was down mass on a SpaceX capsule. So it takes 2 months to get a sample down from the space station. And basically, we were correct. So that's sort of kind of pretty crazy, like when you think about it. So basically, at the end of the day, because our tech is going to be able to measure right there at that point in time, it's going to give you a more accurate answer, as in that case. So they actually didn't know that something happened to their sample in transit.
That's a great example, and I think a lot of us would like to understand how important or critical it is to test in space. Why does this matter instead of being, on top of being super cool?
So NASA is interested in doing this because when you travel on Mars, it takes about a round trip of 2 years, depending on the window. So that's a really long time. And so in space, you've got zero gravity. So you can have bone loss from zero gravity. You can your heart actually changes. You have vision changes too because now you have something called fluid shift in your body. So basically now your eyeballs basically carry on more fluid and everything becomes blurry after a few months. And then you have circadian rhythm changes too. So basically you don't have a sleep, day-night sleep cycle anymore. So they have to put these lamps on you. And then you've got radiation bombarding your spacecraft because of lack of atmosphere. So basically everything can go wrong on the human body. In fact, actually, they just had a medical event on the station. They had to take an astronaut back down. And that's just only that's close, right? I mean, that's super close. And so when you're sitting in a space capsule, even when let's say you're midway to Mars, the big thing is that you don't really have full contact with medical capabilities, which is Houston, right? So even on our demonstration on orbit, there were blackout periods of 30 minutes. So we would be, it's like, where's the astronaut? They're gone. So when you're going to Mars, it's the same thing. You're going to have a delay in communication of 45 minutes. And in that time frame, let's say you had an emergency, and you can't get medical advice. So you need this autonomous medical feedback system. So take the blood sample, get result, get interpretation, what to do, and boom, you're done.
That's wild. That's wild. We had a question come in for you from Pam Marshall, Partial. Excuse me, Pam. She asks, how do you check the accuracy of your machines over a period of time? Are there standards and normal specimens to compare to make sure the machine is functioning properly?
And that's a great question. So as required as part of our device, there are controls that you have to test on the instrument every so often over, let's call it every once a month or something like that to verify the accuracy of the device. So in a hospital, they're required to test it once a day. So even the glucometers that they have in the hospitals, it's basically tested on basically 2 sets of known samples every day in the morning by the nurses. So in this case, it's the same thing, basically. And we basically know our device performs over time pretty much the same. Basically, you can actually turn the device off and come back in a few months. It still pretty much is the same. So
That's terrific. That is absolutely terrific. Of course, that's the kind of the gold standard. Paul, do you have a follow up for Eugene?
Yeah, I'm curious.
Wait, Woody didn't get a turn yet.
Oh no, I'm sorry. Go ahead,
First-
Woody.
First, it's like ask another question 2 in a row, and now you just want to ignore me. All right, listen, Dr. Eugene. This is what you, Paul. I'll let you go after me. Okay.
We love you, Woody.
So my doctor's like, Woody, you need to go get your blood work done. Head back over to Quest Diagnostic or LabCorp. Are you displacing them? Are they an area? Are you working with them? Is this something that we're going to be doing at home? I know you're talking about the app. When does the app come out? This is all fascinating. It could be useful to me right now. So just wanting to know when I can use this.
That's great. So for us, it's so the solution set again is the device, the app, and you have these consumables that perform the panels. So for us, it's you have to go through the reg steps. So I guess the first question is are we going to displace Quest Diagnostics? That's a good question. I mean, I think to some degree over time, basically shift will be healthcare at home, right? And so when you look at healthcare at home, it's way more convenient than healthcare at Quest Diagnostics, even when they're offering basically, you can actually walk into LabCorp at now, like here in Massachusetts, and get your blood drawn. I've actually done that once. And for me, it was still 3 hours to get there. So it wasn't really that much faster, and I had to pay out of pocket, and not my insurance. And so so there's still significant challenges to both Quest and also I think the other one that I think maybe a little closer to is mail-in tests. So right now there's a whole industry which is kits. So basically, you'll send you a blood kit at home, and basically now you can perform the kit and send your sample back, and then you get a result. That's still not that satisfying because when these things first came out, I actually bought a kit, and recently I looked at my cupboard, and it's actually still there. And my sample is actually still in there. So it's almost like people are kind of interesting, in the sense that I need the result now. Just like we're so used to phones and all these wonderful tech. And so to answer your question about when can I get it, as a patient. So it kind of depends if you fall in that hematology bucket. So those are the first tests that are going to come out, and basically, that's in the 2 to 3 year time frame. That you'll start in 2027. You'll start to see this tech in hospitals, with these kind of early access, kind of scientific-minded medical types, and then after that, then it'll be more broadly available.
And so, if we have this as a at-home use, will insurance be paying for it, or this is something that is going to be cost is going to be driven down so much that you don't even have to worry about insurance?
So our first step is basically going to you should be able to get this through your physician. So that's sort of how it's going to get reimbursed. So they're going to be the prescriber of the test, and the exact reimbursement model is going to probably be closer to the equipment leasing with sort of the test that's getting reimbursed by basically whatever the insurance agencies, Medicare. And so that model is, there's a lot of details to that model, but I think so far we like that because at the end of the day, you're still going to get a co-pilot. So we're not going to displace your doctor. So we're making recommendations for healthcare as well as what to do with the information. But we want your doctor to be still fully involved in your care because someone still has to be kind of, let's say, you have a completely out of range value and basically the nurse on the other side kind of sees it on her portal. we want something to be done about it so that they can also be in the loop about sort of the status of your healthcare, basically lifetime.
Fantastic. Well, I hate to call time, but we are kind of at that moment. We have now heard from all of our presenting companies and great presentations from all of them. There isn't one of these I wouldn't like to invest in. I think all of them have compelling stories. I'm excited to see what happens, who the judges pick, who you pick as an audience, folks. We're going to take a quick break. When we come back, we'll hear closing arguments from each of our four entrepreneurs, and then the judges will begin their deliberation while you vote. Stick around. You do not want to miss a second of what's going on here. Thank you so much.
Digital Niche Agency is the top investor acquisition agency. DNA has helped founders raise over 9 figures via regulated investment crowdfunding with a 3-pronged strategy using digital advertising, content marketing, and strategic outreach. Book a call today.
You built it with your audience. Now let them own a piece. The next generation of startups won't just have customers. They'll have shareholders. Raise with Dealmaker. This is capital on your terms.
If you're building a company driven by purpose and proving it with real revenue growth, this is for you. Purpose Built 100 recognizes the 100 fastest growing purpose-driven companies in America, selected based on documented 5-year revenue growth. Winners are featured in a nationally televised showcase and a hardbound book. Built on purpose. Proven by growth. Apply now at purposebuilt100.com.
Welcome back, everyone. I am so excited here as we enter kind of the final moments of this live pitch. We're going to ask each of our presenters to deliver their closing arguments, if you will. We'll give each of them 60 seconds to make their final case for why they should be getting your vote for the Super Crowd Award and why they should be getting your money as an investment. Eugene, you're first. Take it away.
Hi there. I'm the founder of Our Health, a blood diagnostic company, and we're focused on bringing our space-based technology into your home. And you can invest right, see, over here, right there. See, and thank you so much, and hope to bring this technology, share it with you everywhere.
Fantastic. Thank you so much, Eugene. We're going to go next to, we'll kind of go in reverse order here. So Dr. Sahas will be next. You know, we've got a lot of smart people on the show tonight. I'm a little intimidated being around all of these super smart people. Where did I hide Dr. Sahas? There he is. Chandon, thanks for helping me out.
Thank you, David. I'm Dr. Prem Sahas. I'm the founder of My Diabetes Health. We have built a solution which is going to help millions of people with diabetes, help to reduce the complications related to diabetes, and help reduce the cost related to diabetes and improve well-being. So please vote for me, invest in My Diabetes Health. I would recommend you to invest in the future you want to live in. Thank you.
Excellent. Thank you so much, Dr. Sahas. Alrighty, our next presenter will be Gigawatt. Of course, that's Deep. Deep, there you are. Deep, you've got 60 seconds. Take it away.
Thanks, Devin. Gigawatt's building the Home Depot of energy. We're already proven demand with over $64 million in revenues, strong margins, and a growing base of customers who trust us to help them break free from the grid. We've developed a platform that simplifies what traditionally has been a complex, bringing products, design, and services into one seamless experience. We're operating in a massive and growing market and have a clear path to scale this business to $100 million and beyond. At this stage, we're not looking to prove our model, but we're looking to execute and scale what already works. Thanks, Devin.
All righty. Thank you. This is so much fun. Now, our final presenter will be Dale Walker. Dale, take it away.
Well, it has been an honor to be included in these wonderful presenters. And I recognize that your technology is way ahead of what I'm trying to do. But I hope some people have been able to recognize that BRG Therapeutics is trying to solve a problem for which we currently do not have a solution. And the lack of that solution causes hundreds of thousands of people in this country and around the world to lose family members and experience the kinds of pain that my brother and I have known in our lives. So I would like to ask you to visit my campaign on Funding Hope, and let's start a conversation. Let's talk about how we can work together to advance this technology and solve this problem. Thank you.
Fantastic, Dale. Great job. Great job. This has been so much fun for me tonight, and I hope for all of you. We're now at my favorite point of the show. I love every pitch. I love all the questions, and I'm always impressed because our judges ask such insightful, powerful questions. They're not messing around, and so now we get to actually watch them as they deliberate on their choice of who will be the Judge's Choice Award winner tonight, while all of you in the audience vote for the Super Crowd Award winner. So, Shannon, let me invite you to pull up the judging URL, and I'm going to bring up this timer, and we'll get that started. Let me just make that big for a second. Okay, so we've got a couple of bad links on the screen, but I'm going to fix those. They'll all work. But Chandon, the correct link for tonight is vote 987. S4G.biz/987, or scan that QR code at the bottom. Chandon, leave that up, and we will ask the judges to deliberate while everyone votes.
Okay.
Go ahead, judges, take it away.
Paul, I think you should have the honors, or Leah, because, clearly I was going too long.
No, it's fine. You know what? Let's do this. Let's take it company by company, and why don't we just start with BRG? What I liked about BRG is the passion, and it clearly the founders have seen something. And of course, I don't understand all the technical aspects, but other people do, and those other people are saying, "Hey, there's something real to this." I also liked the way they structured their deal. I thought it was sensible, but this is a moonshot after all, and we're years and years away. Woody or Leah?
Leah, why don't you go?
I think that Dell just noted it herself that her company is just way earlier than anybody else, and I think that it's critical. I love the idea of using a virus to be able to destroy cancer cells. I think that in the mind of some politicians, it kind of brings some safety concerns, but I know that they're working on it, and only trials will tell us whether it's safe, but it's a moonshot. I know that it's going to be a pass for me for that case, because we have companies that are just have more traction, but it's just so amazing for everybody out here to have the opportunity to invest that early into this technology.
Yeah, I really liked, I love when you have people, doctors, scientists with experience that understand where the opportunities are. And they're like, this was missed before, this is, now we can use technology or AI or something. But, listening to her made me feel and I just buy into a lot of this, by the way, that, oh my gosh, I feel like maybe this is another solution we have at our hands. Now, Leia, I agree with you. This is moonshot, like this is the example of what a moonshot is. But some of these moonshots actually turn into the moonshots. And the thing, so my father was, he's a doctor, he was, and a scientist. And, Dale said the same things I heard my father say, which is you have to prove that it is safe. That's like the most critical thing when you're working on these drugs, because efficacy in the body and safety to make sure it doesn't interact with other things. You want it to work, of course, that's the premise of the whole drug, but is the safety the critical thing? And to see the methodical way that she's approaching it did bring me solace to think that it has that opportunity. And by the way, she's priced it at the point where you want an early stage drug to be priced. It's not priced astronomically high in terms of evaluation, but this is going to take serious capital to get through these clinical trials. So, those were just some of my thoughts on that one.
Yeah. So we got 3 more companies here. We got Gigawatt. I think it's incredible what Deep has done. 19 years of operational experience. This is a real company. This isn't some startup. You get a chance to invest in a real business, which you don't always get. My only concern was the instrument fit. I would feel comfortable with a different instrument to raise capital with, but this is Deep is the kind of founder you want to invest in. So that's my thoughts on Gigawatt. Leah?
Yes, I think I kind of had a concern related to the revenue drop. It's normal that it can happen after 19 years, but it's true that when you invest in such a company and you're kind of taking share into the company, what you want is a company that is going to be growing. And I think that Deep kind of answered my concern, and he did it very well. Geopolitical events, unfortunately, will keep bringing the price of oil up and down. Oil is still very volatile. Fossil fuel is extremely volatile, and that's why electricity itself is going to be volatile, because in a lot of states is actually linked to fossil fuel usage, and that's why a lot of customers can want to just have their own solar panels. And what Deep is doing is making it just way more affordable. A 5-year payback for DIY installation is not that high. So I think it's a company I want to consider for the final vote.
I liked it. I loved how he answered your direct question, Leia. It's not easy to answer why did you have a down year, and why did revenues drop so much. So I appreciated his honesty, his forwardness with it. I both like this little pivot that he's taking into the storage space. I find risk in it, but listen, he's got revenue, he's got a customer base. It's when you look at risk profile of these companies, this clearly in my head is one of the lower risk profiles. I appreciate the passion. I love the fact that he looks so young after 19 years, and that makes me think that he can do another 19 years. All right, next one.
Yeah, so next one is My Diabetes Health. Really, I think he's got a ton of traction here with, having clinically verifiable results. That this early, that I think is something I don't really see too often. So there is something real to what he's doing. It's scaling. Again, my concern is with the structure of the deal. I would rather be that VC getting what he's getting. So that's kind of where I'm at with My Diabetes. But other than that, this is a real company. It's not an idea. This is something real.
You're right, Paul. The traction is pretty impressive. And what I like as well is that there is still a 40% retention rate after 1 year. I honestly was expecting way less, because we see a lot of telehealth platforms. I was kind of expecting a way higher churn rate. And so this is very good. It means that if people are sticking to the platform, hopefully they're sticking to the medicine. Actually, kind of a heads up, we'll have to be in touch, Dr. Sahas, because I already had one of my colleagues who wants to be talking to you. So you did a pretty good impression here.
And I love this one too. I do think this has the potential to be disrupted by AI. I do think that, Leia, you hit the nail on the head with the data. Like, the data is gold in this scenario. He needs to be figuring out how to publish more about the research and what's coming out of the data, because I think it makes the whole storyline that much more compelling. But the AI bot, that's a little quirky thing. I believe you can probably scale this thing with AI, agents that actually, by the way, AI agents can be made to work with the individual these days. So I think there's a learning curve that should come up on this. But let's move on to the last one, because we got a minute and 32.
Yeah, our health. Again, I mean, the validation, the external validation, you can't get much better than our health. NASA, NIH, X Prize, that's serious external validation saying, yeah, this is legit, this is real, and this is something worth doing. I think I also, looking through the details, I can see that Dr. Chan has significant skin in the game for this company. So he really believes in what he's doing. That's another powerful signal for me to kind of like, whoa, this is something to look at. Again, I got to say, the deal terms I'm not crazy about with this one as well. The way it's structured, it's a tough one, because that's kind of what I'm seeing with this cohort, for me anyways, is how these deals are structured. The only one who I think has the correct structure, in my opinion, is BRG, which is the least commercially developed. They're the furthest one away. So that's just kind of my take on what I'm seeing.
I think, like most human beings out there, I'm very sensitive to a good story. And just Dr. Chen kind of proved that Houston or wherever the on-Earth lab made a mistake. Well, his product was actually accurate in space. Of course, there's just a lot of other reasons why I like this company, and we're running out of time, but I think you have my vote tonight, Dr. Chen.
All right. Well, go ahead, Woody.
All right. Well, I was just going to say, I really like the story. I still am not completely, I love the fact that NASA used it up there. I still want to see more proof that this is not another Theranos. And I know the fact that Theranos wasn't invited up to space, but I'd be more comfortable if I saw some use cases on Earth where this was being actually used, and how close they are to getting that approval for it to get my vote. So I think we need to take our votes right now.
Yeah, what do you think, Woody?
I have to say that, going over these things, Paul, I think you hit the nail on the head with the structure of these deals. I think valuations can be sort of out of whack. I think I'm going to have to go with my diabetes health on this one. I just like the structure of it. I like the revenue. It seems logical in terms of growth to me.
Okay, so Leia, you were our health. Woody, my diabetes health, and I'm BRG. So we've got a little three-way split. And the crazy thing is normally I would be someone who would be voting for gigawatt, because that's typically what I do. So this is a very unusual situation here. What are we going to do about it?
Well, how about this? What is everyone's second place?
I was about to say my second place is my diabetes health. I don't know if that helps the vote here.
And my second place was gigawatt.
Same with mine. Mine was second place was gigawatt. But now we have a different situation with Leia saying second and first, so it complicates things a little bit further. Devin, do you want to help us out? What do you see a result here? Is it gigawatt or my diabetes health?
Let's see here. We had a pure tie on the first vote. So if we look only at second votes, we had 2 gigawatts. So I think by the closest of hairs, like the shortest nose hair you can imagine, I think that I interpret the data as telling me gigawatt is our by a nose hair, not a nose, but by a nose hair, the Judge's Choice Award. Did you think that that was a reasonable analysis of your deliberation?
Yeah, interestingly enough, it was the only company that none of us had at first, and now it ends up being the winner. Yeah, let's go with it. Anybody else have a problem? Yeah.
Okay, that's a crazy outcome, but congratulations, Deep. I want to commend you for your recognition. Let me bring you on the screen for a second here, and maybe you can just say a quick acknowledgement. We just have a few seconds here, but congratulations, Deep.
Yeah, thanks, Devin. Thanks, judges. Through this experience, I've learned a lot, from listening to the feedback and refining the pitches. And everyone on this show has been a wonderful entrepreneur, and I wish everyone the best of luck. Thank you, everyone.
All righty, Deep. Thank you so much. Now I get to announce, this is kind of a fun part for me at the end of every program, is to announce the winner. Now, I want you to think about this. We literally take a poll live in 10 minutes. In 10 minutes, the live audience gets to choose the Super Crowd winner. And tonight, the Super Crowd winner is Dale Walker. Dale, congratulations. You are the Super Crowd winner tonight. What do you think?
She's thrilled, of course.
I couldn't be happier.
She can't unmute herself, but she's thrilled. She's happy. She's ecstatic. Congratulations, Dale.
You're so happy.
We see
it's the best day.
Yeah, I feel like a little bit like we're watching a foreign film and narrating it for them. Okay, so thank you very, very much. Let's see. I want to just thank and acknowledge all of our competitors tonight because, talk about a close competition. We had really an outstanding roster of entrepreneurs. I think in a different situation, any of them might have won a Judge's Choice selection against another roster of companies. All strong. I want to congratulate all of you for your good showing. Chandon, if I could trouble you to do it, if you could pull up the join the private session. You got the right idea. I see that coming up. We really would love to have every one of you who's watching with interest in investing. Again, this isn't a place for networking or hanging out tonight, but this is a place where if you're interested in investing in these companies, whether it's $100 or $1 million, please join us. There's no charge. Everyone's welcome. We ask you to screen yourself only. s4g.biz/investor to register for that. And judges, you too are also welcome. And we'd love to have you there for this discussion. Although, Leah, congratulations on your new baby. You may have other things you need to do tonight. But listen, everybody, thank you all for being here. Again, congratulations to the outstanding roster of competitors. We're thrilled and honored to have you. And with that, we're going to close the show and look for you all in the investor session.
Thank you.